Hi, I'm Dr. Allen from Jones Animal Hospital. Welcome to Vet Visits. Today we're going to talk about management of arthritis. Often we don't think about arthritis in our pets. We think about arthritis in us as we get older or in our parents or grandparents, but our dogs and even our cats can develop arthritic changes in their joints as they age. And that's really a pretty common problem to see, much more easily recognized in dogs than in cats, but we do see it, as I said, in cats as well. Very often, the first thing you'll notice in your dogs is they're a little slow getting up, sometimes a little slow getting down. Sometimes they're not jumping up in the car or up on the couch like they used to could, don't want to chase the ball or have a little trouble with stairs. Those are the sorts of early signs that we'll see, with arthritis in our dogs. In cats, you may notice them just not up in the windowsill as often, or sometimes they're not able to jump over the edge to get in their litter box. Sometimes they're not up on the couch or favorite resting places. In cats, it's a lot more subtle, the changes are, than in dogs, but they do have arthritic changes too. There's kind of a handful of things we can do to help manage arthritis in our pets. The first thing I always point out to the pet owner, though, is that it's a problem that can be managed and often slowed down, but we're never going to cure it. It's always going to be progressive, and our goal is to keep the pet comfortable and manage the development of further problems from the arthritis. The first thing I tell people is keep your pet at a good lean body weight. Carrying extra weight is just like putting a ton of gravel in a half-ton pickup truck. You're going to wear it out faster. It does okay for a while, but constantly overloading joints, like constantly overloading the shocks in your truck, is going to eventually wear it out and wear it out more quickly than if they're carrying a normal body weight. The second thing is maintain exercise. Not just throwing the frisbee on Sunday afternoon, but regularly walking the dog, preferably every day for a significant amount of time. Regular exercise helps to maintain muscle mass, which helps maintain soft tissue support of the joints, which takes some of the pressure off the cartilage that covers the joints. The third thing is nutritional supplements, and there's a couple of those that are very effective in helping the joints. Many people take glucosamine and chondroitin combinations. Those help to maintain the joint cartilage, help to maintain the joint fluid, and have a little mild anti-inflammatory activity. The omega fatty acids, which come from fish oil, good for the joints as well as the heart and the skin, but those also have a very positive effect on the joint cartilage and the joint fluid. So the nutritional supplements are the third thing that we do as our pets develop arthritic changes. The fourth thing are anti-inflammatories. We use many of the same anti-inflammatories that people use. Meloxicam is one. Occasionally we'll use something like aspirin. Ibuprofen is not one that we use, and it's very important to remember that ibuprofen is not used in dogs or cats, either one. It's very bad to cause gastric ulcers and can really create a lot more problems than you're trying to help. There are also some veterinary specific anti-inflammatories that we commonly use. Carprofen or Rimadyl is one. Deramax is another, but there's several good anti-inflammatories. So in the early stages, we'll use anti-inflammatories kind of on an as-needed basis. As the arthritis progresses, often we begin to use the anti-inflammatories as maintenance drugs. That's drugs that are given every single day. And we can get a lot of relief from those. The last thing, when everything else is not working anymore, we can put them on some pure pain medicines. And we'll often use things like gabapentin or tramadol, sometimes even the opioids as the pain gets further along. And each time we go to a different stage of arthritis, we're not taking away things we've done before, we're just adding on to them. So by the end of the day with an arthritic patient, they're maintaining body weight, they're maintaining muscle mass with exercises, they're putting them on the nutritional supplements, the glucosamine and chondroitin, the fish oil with the omega fatty acids, the anti-inflammatories, and the pain medicines. And in most cases, we can provide a very good level of comfort for our patients well on into old age. Again, arthritis is not curable, but in most cases, it's manageable, and we can very often keep pets comfortable much longer than they would have been otherwise without some very good management. Thanks for listening. I'm Dr. Allen from Jones Animal Hospital. This has been Vet Visits.